The bane of our existence as physicians is sometimes documentation and doing things that don't really pertain directly to patient care, but it's just something that we have to do to get through the day. I'm very excited today to be speaking with Dr. Aaron Grotas. He has just started using something called virtual assistants, and he is hailing from New York, so I really appreciate Dr. Grotas for donating his time on a Saturday to help us out. Welcome, Dr. Grotas.
Thank you, John. So I first learned about this service called Hello Rache um, by being directly marketed to. And then Dr. Casperson was on your podcast or your Facebook live feed, and she talked about how much it helped her. And I figured, well, hey, it's only $9 an hour. I'm busy, but if something could save me a lot of time at $9 an hour, I'm willing to try it. Scribe services in New York cost about $20+ an hour, especially if you get them through a service where they have dedicated people who have training. This company, which is based out of the Philippines, for at least where they get their scribes from, they offer the services where you pay a flat fee of $9 an hour, and they already come with HIPAA training and some basic medical training.
So what I'm gonna show on the screen here is the website for Hello Rache. And by the way, this interview is not being sponsored by any company. So go ahead, Aaron.
Right. Okay. Yes. And by the way, right, I am not being paid by Hello Rache, and this is not necessarily an endorsement of the authenticity of their work. It's really just my personal experience, but I'm pretty happy so far with using this service. So basically, there's a very simple enrollment. And once you tell them what your needs are and how often you need them, they give you video and paper PDF resumes with recordings of the person that you're going to choose. Now, there were RNs from the Philippines that were available at this rate of $9 an hour. And
Wow.
that's not what they're getting paid. That's the total cost for you. And if you think about it, John, as you know, as a businessman, if you pay somebody 15 or $20 an hour, if you have to pay for their health insurance and pay for fringe benefits, even your retirement fund for them after a while, $9 an hour is probably the equivalent of paying someone in your office $5 an hour. So that's really nothing for me. They needed a dedicated amount of hours to have a consistent person. It's 30 hours a week.
So they require Hello Rache requires you to have a 30-hour commitment for a particular, so that you get a consistent virtual assistant.
Yes, or else you'd have to figure out something else for them to do besides scribing during that time.
Got it.
But if you think about it, at $9 an hour, that's only a commitment of under $300 a week.
Correct.
And they will let you do not have to pay them if you don't work. I was off for the last week and a half. I took my kids away for Christmas break, and I did not pay one dime.
Got it.
They were totally cool with it. They're holding my virtual assistant for me. And so let's just talk about, so why did I think I needed a virtual assistant?
Yes.
Let's just talk about that. What was the need? So I'm very computer savvy. I'm 43 years old. I really like computers, okay? I don't like the 55 mouse clicks it takes me to get through a chart.
Oh, 100%.
Okay? So over the summer, before I hired Hello Rache, I had a college student who was doing nothing all summer. She was going to go work at the Gap. And I just had her put some of my templates into my EHR, which is Office Ally, which is not a very robust EHR. It comes almost free with my practice management software.
Wow.
But it works. And it comes up with, it's all HTML based, and it comes up with nice looking stuff. I publish notes that have my picture on them with a letterhead. It works for me. But the problem is that I just was getting behind on my notes. I was writing paper notes and scanning them because I was getting lazy. And I wanted to up my game because, at the hospital, we use Epic. We produce these 4-page notes for every patient. And I feel like I shouldn't have a different standard of care that I'm in the hospital, I write a nice note, and then I write chicken scratch in my office, or kind of lollygag through a pre-written note and not do like a good job.
Mm-hmm.
So, um, so I had this assistant over the summer just put a lot of my most common procedures, vasectomy, cysto, prostate biopsy, all as templates. So I can just do a drop down and 5 or 6 mouse clicks, put through a nice note that documents exactly what I did and how I did it. However, even that, you thought that, okay, come September, she went back to school. This was happening for every patient while the patient was being seen. No, because I don't have a nurse or a PA in the office. I do a lot of my own prescribing of medications. I do a lot of my own everything. So because of all that, and all the patients want to talk to me, I don't have a PA or an NP. So patients want to talk to me, but that's part of my brand. And I realize that, and people require a lot of personal attention from me, but that's how I stay busy, and it works for me. So I decided that, hey, Kelly says she saves her all this time. And the whole concept of pajama time, meaning that you're not doing stuff when you get home. And my point is, I don't think that's correct. I think you should always be thinking about your business if you want to be a success. But what I want to do when I'm not in the office is work on projects related to my practice or other businesses that will also make me money, not work on my note that I didn't do or some list of patients that I saw during the day and
Oh my
audited for
gosh.
them and like have to do this when I get home.
I used
Forget
to
about
I
that.
used to do that during residency. We had, your
Yeah,
list of
the
patients and
list.
then you fold the paper over and you have to write the things that you have to do for that patient. Oh my gosh. First of all, there's
So
so
I
much.
still run the list.
Yeah.
Yeah.
So first of all, there's so much to unpack. Number one,
Yes.
let's talk about your practice. You're a
Yes.
solo provider practice. You spend most of your time in your office and then some time also in a hospital type, quasi employed type of a situation. And
Correct.
I think that we are so much alike. I think the same way as you. Yes, when I go home, I don't ever have to work on my notes because I do everything. I complete everything here. But I'm never off because just like you, I'm constantly thinking, I'm doing that SWOT analysis, right? Strengths, weaknesses, opportunities, and threats. So I'm constantly thinking about how to make the practice better and how to run things more efficiently. So I'm so there with you. And just like you, I'm also a slight computer geek. So I enjoy technology. I enjoy what it can do for us. But let's see, you also said something about your summer scribe. She's going to be gone after the summer. And that's the problem with having a real scribe that is here with you. Not in addition to the cost difference between a virtual assistant and a real assistant. The virtual assistant seems like there's a company that provides the VA, and they can have someone else replace that person in case he or she is absent. Although that replacement is not going to be familiar with your protocols and your shortcuts.
That's correct, and that's why the nice thing about Hello Rache, it's not just a service. I have my own assistant, even though she lives in Cebu, Philippines. Um,
So
so
first of all,
yeah.
before we go further, how I wanted to interview you because I wanted to get your initial impressions, and you already mentioned that you found Hello Rache through a direct marketing that they did. How long have you been using the virtual assistant?
I think so. I used it about 3 weeks in December,
Great.
and then I was away for the last week. So the first week and the first couple of days was a little bit painful,
Wait, let me.
but part of it was
So
yeah. Go
hang on.
ahead.
Tell us what the starting process. What is it? What is involved?
Okay, so first you have to pick an assistant. So you tell them what your needs are, and they send you videos, and then you can do a live interview
How did
of
you?
that
What were
person.
your criteria? How did you pick your VA?
Okay, so because the VA and I were going to be chatting like this, and the VA was going to be listening to me and how I talk, I wanted someone. So there were nurses, and then there were other types of quasi professionals who sign up to be virtual assistants. At first, I thought I really wanted a nurse. And then when I unpacked it, some of the nurses were, their accents were difficult to understand. So I picked somebody who was very presentable if they were going to be in a video conference like this with a patient, which is something they can do, and someone who was easy to understand and not necessarily be identified as someone who was around the world, not someone native. Because if they're going to be calling insurance companies and calling patients for me, I don't want people to think that I necessarily outsource to somewhere cheaper, because I want my practice to be associated with quality. That I hire quality people. People are the people who work for me are like family. And that's the kind of practice I want. And when you have a practice like that, people stay, they're loyal to you. Because what happens in medicine now, people only want to go to somewhere on their plan who's available that day. In New York, especially in New York City, a lot of people use ZocDoc, where they'll see 5 different ENT surgeons for the same sinusitis problem during the year, because that's who is available during their lunch period.
Wow. That's interesting.
So my assistant's named Shasha, and she's fantastic. But so at first I thought, wow, she's going to catch on right away, and after the first day, we're going to be up and running. So what I first did with her is I didn't have her see patients with me. I and we used a sort of a free trial of a HIPAA compliant video chat called Blue Jeans. So Blue Jeans is only about $14 or $15 a month. It's probably very similar to Zoom that we're using now, but it's very good at allowing screen sharing.
Got it.
And then it was fine. She didn't really want to use it. She thought that the connection was poor on her end.
Ah,
It did seem fine to me, especially in the US. It looks like it works just fine. But what happens is it's not as robust as some other systems. So Google has all of these tools. And the most HIPAA compliant way to talk to somebody or hire someone who doesn't work at your practice is to establish a Google Suite or other proprietary email address for that person and for yourself, and use one cloud share that's HIPAA compliant for you. So we now use a Google Suite product that costs me, right now, I think it costs me $12 a month total. And that allows me Google Hangouts and chats, as well as a cloud and proprietary email that's HIPAA compliant. I can email back and forth and do Google Chats with screen sharing with no problem. And if I want to show her something or have her put something into the EHR, I can have it scanned directly into the cloud, and then she can deal with it. So if you think about this, that represents a lot of tasks that your staff are doing now, and you're paying them a fortune to do. Some people in the thriving urology practice are even using office managers to do some of these tasks. My office manager chases the money. She figures out if we didn't get paid for something, or something is an expensive procedure, that's what I want her doing and dealing with problems. I don't want her scanning stuff. I don't want her doing things that don't require expertise.
I think that sounds very, very reasonable. You are using the staff that you have at the top of their working capacity instead of doing
Right.
menial tasks. And I encourage everyone to do that in your own practice. Think about who is doing what, and can they be doing something that is more productive. And I 100% agree with you that the IRL person should be dealing with the headaches and problems that are more complex that someone else in the Philippines or somewhere else in the world can't handle.
Agreed. So once we started with the process, I at first I was working on an iPad in the office to do the chat, and then I switched a to do video chat and screen sharing through one of my main PCs in the office, just because the screen was a little bigger. It was easier to share back and forth, and with a hardwired internet connection, it was just a little stronger
So
and
is
more
this
reliable.
still during your trial? You're still testing things out?
Yes.
Okay.
So we're using Google Suite now, and Google Hangouts, it's called, which is the one where you can share your screen and stuff like that.
And for those who are not familiar with the Google suite of products, you can get all of that in a free fashion, but it is not HIPAA compliant. So for healthcare, if you want to communicate protected health information, you should consider getting the Google Suite so that you can communicate in a secure fashion. So that's Google Suite. And
Right.
Hangouts
And
is
yes,
available as a
go
free
ahead.
app on your phone, and you can do it on a desktop as well. So you can certainly try that out with your peers first and see if you like it
Mhm.
before you dive into this very small cost of $12 a month to get the suite.
Right. And you can even add other email addresses like info@newyorkuro.com or Sunrise Urology, where you can add those email addresses for free. But it sounds like you need to have at least one or two named, and you pay for email addresses. I don't know if you can use the info or some non-named email address to participate in Hangouts. Maybe you can. Maybe there's a way around. Maybe you only need to pay $6 a month, but I'm happy paying the $12 a month and being HIPAA compliant. Interestingly, if you get a patient to sign a waiver, you can text back and forth with them without a HIPAA compliant software, but they need to acknowledge that it's not HIPAA compliant.
Sure.
Um, I don't do that. I really try not to do that. But interestingly, as long as they waive their right to being HIPAA compliant, it's technically okay to text with them.
And believe it or not, email is not unsecure. Just putting that out there, but let's stick on topic. So
Absolutely.
you are trialing this VA initially using an iPad, and are you carrying this iPad around your office, or how does that
So
work?
a lot of the times, at least during the training period, Kelly uses it in the room with the patients when she's working.
Yeah, yeah.
Um, as a urologist, I thought it was kind of be a little creepy to be like have a virtual assistant in the room during exams, especially because genitalia is exposed a lot of the time. So for now, I do not bring her into the exam rooms with me. I have another room, like an office room, where I sit at a desk and do some typing and answer phone calls. So I leave her in that room 99% of the time. And the reason for that is I just didn't want to, until I have it fully implemented. And I may have her in every room and all the time. But for now, I wanted to make sure I got the system down right, because when you present people, especially elderly patients, you say, oh, well, there's a virtual assistant listening into what's going on.
They're like, what?
Right. Huh? Where are they?
What is a
And,
virtual assistant?
right. And sometimes, so I would leave the camera facing towards me, but they would hear like her make some noise in the background.
Oh,
So like I'd have to explain what's going on, and everyone was cool with it. No one was upset with me. But I think that what if I'm going to keep this on long term, I'm going to add to sort of my consents when people agree to accept assignment for payment and stuff. I'm going to add a consent saying Dr. Grotas uses virtual assistants. They are part of the office and just like an extension of the office. And patients will consent to potentially their audio at least being broadcast in a secure fashion, as
to one
well as
person.
right, operator standing by, not recorded,
Yeah,
right?
yeah.
And that
I think that's a good idea.
also consenting maybe that this virtual assistant might contact them for questions or as an extension of the office. Let's say we forgot to update the allergies, and then that's something that they could do through a free phone line through the office using Doximity or something like that, Doximity dialer, and call from the office, even though they're calling from the Philippines.
You bet.
Cool.
What you just said, I mean, just there's so many ways to skin this game or cat of healthcare. I mean, the way you're doing it is different than how I'm doing it. My EHR is different than your EHR because I can do a lot of the documentation using a lot of templates, shortcuts, and I'm not taking any documentation home. I also use Dragon, which is voice recognition at a workstation when I in the clinic area. I also have that loaded here at this computer, and also have it loaded in my tiny little office. So wherever I am, I can do the dictation, and I finish my charts before I leave the office. And I think certainly the quality of my charting is much better here than what I use in the hospital's EHR. That's for sure.
Right.
Okay, so 3 weeks in, you are still not taking her into the exam room completely yet, and so she is in a separate clinic, a little office.
Right, she's at like a workstation.
Yeah.
So, right. So the thing is, if you think about it, some of the stuff I do, if I'm doing a cysto or a urolift, my memory is pretty good. As long as I unpack that data that day or within a few minutes, I'll do a urolift. I'll tell her how many stitches I put in, if there was a median lobe or not.
Got it.
And it takes her 2 seconds to do that. So I also have her doing, I know I flashed a sheet of like my billing for the day. I also have her doing that billing. So she'll put the CPT codes and ICD-10 codes into the EHR, into the practice management software. I don't trust her yet to submit the claims for me. I review all the claims still. But if you think about it, in most EHRs, you're putting that CPT and ICD-10 codes in.
Yes.
Like you talked about typing that 5 or 6 digit ICD-10 code. Now, if you had someone doing all of that for you and all you had to do is just eyeball it and double check that it was done correctly, it does save you a good 30 minutes a day for a full day of office hours. And that time is precious to me because that means I can do a consulting project for an hour to get paid, or do something that gives me fulfillment, like hang out with my kids and going to play tennis. So if you think about it, we all need to, why are doctors burnt out? And urologists in particular are super burnt out. They're super burnt out because they're doing a lot of things that don't give them satisfaction. Most people don't complain that they had to, I don't get burnt out from telling somebody they have cancer or helping them, treating their fertility or doing a vasectomy on them. I get burnt out by getting prior authorization. I get burnt out by having to type notes or submit to an audit something that is not prepared, and I have to totally make sure I organize everything and make sure we have all the right stuff. That's what gives me burnout. I don't get burnt out from actually helping people.
Yeah, I totally get it. EHR and the bureaucratic crap that we deal with, that is what really gives physicians burnout. We didn't get into this calling or career to fill out paperwork or type or click on a template. That all came on after we finished training, and this is just dropped on us. So I think a lot of the less tech savvy or those of us who are less willing to change finds this a huge burden. And I've found it to be a fun game because I'm interested in technology. I participate in investments in the tech sector and in the startup sector. So I'm really, really interested in technology and how it can improve our lives and help us. Likewise, I think of electronic health. And that's part of the reason I bought really a Lamborghini of electronic health records to help facilitate the documentation. And so to minimize the amount of work that I have to do, I don't have to type in any ICD-10s or CPTs. I simply pick a phrase that makes sense to me that is associated with the CPT, and that ICD-10 and CPT pair is sent to my biller, who clicks a button, imports it into the practice management. She looks at it like what you're doing. She looks at it to make sure everything matches the schedule and everything makes sense, and she sent it through the first pass claim scrubbing. If it goes through, she sends it to the clearinghouse, and we're done with billing. So average gross charges days in AR for me is typically less than 18 days, meaning from the time the service is provided until we are paid in full, it's less than 18 days.
That's great.
Yeah, so every practice is different. I mean, you're running it your way, and I'm doing my way. We're both having a lot of fun. I cannot relate to burnout because I'm having so much fun, like doing things like this. You know, interviewing someone who is doing something innovative, something different, and sharing it with the tribe.
Definitely.
Okay, so now you're 3 weeks in. What is the next step for instead of leaving her in the corner, leaving baby in the corner? Instead of leaving her in the corner,
So, right.
go ahead.
So I think that the next step is that I would have a Bluetooth earpiece or a little microphone on my shirt lapel, and she would go with me everywhere. Even if she can't see what's going on, she would listen to me throughout the whole day. And she would be like artificial intelligence, where she would say, I heard you did a renal ultrasound and there was hydronephrosis on the right side. So I opened the template for renal ultrasound. She opens the template, she documents that and say, was there anything else going on? And she asked me the question even while I'm doing it. So I can then say to the patient what's going on, and she'll put it all in the note. Um, in addition, I need to get my other office staff on board with scanning in real time. So everything is available to my virtual assistant. So when a new patient comes in, they fill out paperwork. Like that has to be instantly uploaded so that I don't have to necessarily send it to the virtual assistant, or I don't have to read her what's going on
Yes,
the page.
yes.
So that's the next level. And then the level after that is how can I leverage this person even more? So right now, our office calls back all the patients with their blood tests because I have a lot of elderly patients. They want phone calls. They want to know their PSA was still 2. And they don't need to hear it from me, but they want to hear it. And that's part of my practice. My practice, sort of a lot of places now, you got to log on, you got to check my chart or this. And urology patients who are tech savvy may like it. I found that most of my patients in my private practice don't like it. They want to know from me what's going on. The
And
more feedback I give my patients, the happier they are.
yes, so what you mentioned earlier, how that how you see patients yourself instead of having an APP or something like that as part of your brand, that's exactly part of my brand. So I have two things. One is timely urologic care, and number two, you'll see a physician every time you come into the office. So that's part of the brand. And healthcare is truly regional. I have a lot of patients who are really tech savvy. Even the older people. Now here's something that you can observe next time you see patients. When you walk into the exam rooms, what are your patients doing? Now 10 years ago, most of my elderly patients are reading a book or reading a magazine that I had in the reception area. Now everyone is on their phones. Everyone, including the older folks. Nobody's reading an ebook anymore. Nobody's looking at magazines. So think about how connected everyone is, not just the young kids, not the millennials, Gen X, Gen Y, but even those who are, Medicare, traditional Medicare age, 65 and older. They're all tech savvy. But like you said, your patients want to hear from you. So, which is interesting. Healthcare is so regional. I mean, the billing aspect, the patient care aspect, how you communicate with your primary care doctors is so regional. It's interesting.
Right. So one thing I've used now is Doximity will allow one-way texting now. And I've used that for if I call a patient to tell them something, especially something where I need to speak to them directly and they don't pick up, even if I leave a message, I will text them that we're looking for them in Doximity. And they get a one-way text message that's HIPAA compliant that tells them that we're looking for them. And I find that cuts down on the time. Everybody calls back right away when they get this. And it saves me a lot of time because there's nothing sitting in my inbox, virtual inbox or real inbox, of waiting for the patients to call me back 3 days later. And then something hanging over my head, a liability for me that I didn't tell somebody that they need to come in, they need a CAT scan, they need something done, they have cancer, what have you. I don't have to wait extra time.
So the benefit
And
of
I think,
so the benefit of this doximity, just to make sure everyone understands, the benefit of this doximity one-way texting is that you can use a proxy, like a phone number that is actually your office phone number. So the text is coming from your office, but it's just a one-way text to the recipient. And also you have to manually put in that text number to the recipient's text number.
You do. There are other formats that are very expensive to do one-way and two-way texting, and I am exploring some more sophisticated solutions. So one of the things that benefits me a lot is that I have a friend who's a dermatologist who spends a lot of time thinking about how to innovate his practice, and I think that as urologists, we spend a lot of time working. The dermatologists, a lot of them, they have PAs, they do, they can see 100 patients in a day. So some of them take days off during the week. And my friend spends a lot of time innovating and inventing things. And it's always good to have a friend who tries to invent stuff because you can learn a lot from these people. And I think that, sometimes I help him beta test stuff for free, try stuff out. He'll say, send a text to this number to see what happens. And I help him play with his software. And I get a lot of benefit out of that because sometimes those things come to me in terms of innovations in the future.
That's interesting you mentioned that. I specifically take off one morning per month. I'm part of an angel investing fund, and I will personally attend all the financial committee meetings where I listen to founders and CEOs of startup companies pitch to us for funding. And that really opens up my mind to think about other things. And also, plus, the short commute to the meeting site allows, believe it or not, downtime for me to think. And for us to innovate, we need that quiet time to think about something else. Otherwise, I'm constantly, like you, I'm constantly thinking about the practice, or I'm reading a book to further and extend my thinking. So that downtime is really important in trying different things and thinking out of the normal box. And that's part of the reason I created the Thriving Urology Practice Facebook group, just so that we can collaborate and like, you trying virtual assistants and Dr. Kasperson, Kelly mentioning virtual assistants. So now this is a thing. Now we can talk about it, which is awesome. And we can share this information.
And anyone can directly message me if they want to talk about it. I'm happy to provide that, initial, contact and answer questions about that. I think that in terms of the next steps for me, in terms of using the virtual assistant, I think that I would take a lot of pause in hiring any other extra live people for the office. If I could, I would really ask myself, well, do I really need a full-time equivalent or a part-time person in the office? Or is this something Shasha could do or another virtual assistant could do? Because now that I have this HIPAA compliant relationship, I'm able to then leverage that because they can call and get prior authorization for things or do electronic prior authorizations. And they, it's part of this stuff, like the new Medicare requirements for imaging in terms of answering these questions, right? Who knows? Maybe that's another avenue to use virtual assistants. And, if radiology companies were smart, they would provide some of this assistance for practices because there are so many different sort of hoops to jump through as doctors. And we have to think about how we can work smarter, not harder.
What you're talking,
we're all done working hard.
Yeah, what you're talking about is something called appropriate use criteria for advanced imaging. That is actually it was beta a couple of years ago, and in 2020 we're in the learning and education and training type of a year right now. So though you can start getting the AUC and the codes. But then in January 1st, 2021, that's going to be mandatory. So that means the radiologists are not going to run your study that you order unless they have that code. The problem is, who's going to get the code? Now, from what I understand, a physician, someone who's qualified or an extension of the ordering physician, ordering professional, can get that code on the ordering professional's behalf. Now, who is classified as an extension or appropriate extension is still up to interpretation. But I'm thinking, like you said, I think the radiology companies should be able to obtain that code yourself. Now, in my electronic health records, they apparently already have the ability for you to click a button and obtain that code, and it'll drop in. Right now, there's a 3-digit code intervening between the prefix and the suffix, and those 3 codes have not been finalized, so we don't have those the 3 alpha, numeric, or is it an alpha code yet? But that is electronically available in certain EHRs, certainly in mine. So anyway, that's coming down the pike. So many, again, another bureaucratic BS, another unfunded mandate that we have to deal with. All right. Hey, Aaron, would it be a bad idea for us to circle back and talk about this as you become more experienced and talk about how you are advancing your use of your VA?
I think that would be great, John. I would like that a lot.
I really appreciate you taking time on a Saturday morning, and thank you so much for contacting me.
Oh, you're welcome, and thank you for all the for what you're doing for this group and for other urologists, because me on a personal level, I think I've learned a lot from the group, and it also inspires me to aim higher, because your talk about how you did over 900 vasectomies this year really inspired me to say, well, if this guy can do it, why can't I aim higher? Why can't I grow my practice? And I grew my practice last year. The metrics are very good. But clearly, if there's one man in Arizona doing 900 vasectomies, I could do 300 vasectomies next year pretty easily. And I don't see why not, given the demographics, and I have such a densely populated area near my office. There's no reason why I can't double or triple the number of vasectomies I do next year. I use the no scalpel technique. I have multiple trays, so I don't have a lot of some practices are restricted in terms of, we can only do 5 or 6 procedures a day maximum. I don't have those restrictions, and I never try in my private practice to restrict my productivity.
I call that
if there are people who need prostate biopsies and urolifts and resumes in the same day, I just do them.
I think of that as a self-imposed limiting mindset, and exactly like what you said. Part of the reason I started this group is to share what I've done so that I can learn from other people what they have done. Like exactly this situation, the virtual assistant, and people from across the country post questions and things that are just not in my wheelhouse. I've never heard before. I never think about it, never thought about it, but it's interesting to me. But as far as vasectomies, we'll talk offline. I will just say that it is not. Marketing is not, and talking about how well you do something for a physician is not a douchey or scammy thing to do. I will leave with this. You can be the best radical robotic prostatectomy urologist in the world, but if nobody knows about you and your skills, you're just another urologist. So I will leave it at that. Hey, thank you so much again, Aaron.
Oh, you're welcome, John. Have a great day.
All right. Thank you very much. And for those of you who are watching until the end, thank you so much for watching. If you're watching this on Facebook, I see James, Joan, Peggy, and Karen. Thank you so much for watching this. I will try to, if I get the permission from Aaron, we'll try to upload this onto YouTube. And those of you who enjoyed this type of format, please give us a like and subscribe and click on the notification bell so you don't miss on any of these recordings that we will put out periodically. Thank you so much. Any questions or comments, leave them in the comment section below. Bye-bye.